Video on reconstitution of neurotoxins. I'm in my closet hiding from my children, so that's what's going on in this neck of the woods. Each neurotoxin we carry, Xeomin, Botox, and Dysport, we consider 100 units. I'm aware that and so we only buy 100 unit bottles, 100 unit. Dysport is actually 300 units per bottle. However, each 3 units of Dysport is equal to 1 unit of Botox. So essentially a 300 unit bottle of Dysport is equal to a 100 unit bottle of Botox. So we treat them as if they're both 100 units. Otherwise, it gets too confusing. If you have a patient that questions this, and it happens maybe once every year or two to me, multiply whatever units that are recorded on your treatment sheet by 3, and then you'll get the actual Dysport units. But Dysport is Dysport, Botox, and Xeomin are all injected the same as far as unit numbers. And because the 3 equals the 1 and it comes in a 300 bottle that's equal to a 100 bottle, we just pretend it's 100 units and we ignore the multiplier and we record it the same way we do Botox and Xeomin, and then we don't have to worry. We dilute it the same, so just pretend all 3 brands are 100 unit bottles and we dilute them all 3 with 1 ml. 1 ml per 100 units. Okay? So, knowing that, for every 100 units, you put in 1 ml of saline. We just got bacteriostatic saline in. Otherwise, we have preservative-free saline, non-bacteriostatic. And if times get desperate, like they did during COVID, you can also use a saline flush from IVs, because it is FDA approved for IV use, as in intravenous. And if it's intravenous, it's intramuscular. So, bottle of saline. This one is 0.9% sodium chloride. So we do carry free water, which is not 0.9%. It is just plain water. It's sterile, so it's safe for IM, just the way that Botox is injected, but it'll sting like a motherfucker. And the reason is that 0.9% of sodium chloride in here is equivalent to the cell makeup in our bodies, and therefore the homeostatic balance between the injection of the saline and our cells does not disrupt the fluid balance, so it does not break apart any membranes or cause cell damage. If you inject free water, you can get the Botox to where it needs to be, and it's just as effective, but you're causing cell damage because there's less sodium and chloride in the diluent than there is in the cell. So you're essentially causing sodium and chloride to come out of the cell, causing the cell membrane to rupture, causing pain and cell damage. So that's that. So just look at every bottle. The bottles that you're going to be looking for are the pink ones and the green ones. The green ones are bacteriostatic. The pink ones are non-bacteriostatic. They are both preservative free, so they are not going to have allergens in them. The benefit of using bacteriostatic, which was out of stock since COVID, is that supposedly it can last up to a month on the shelf, whereas this cannot. However, we go through neurotoxins so quickly that that's really not an issue. Were we to see an an actual injection site infection or anything like that, that would be something where we'd have to reconsider what we were doing as far as practices. However, I've never seen it. So obviously all of us are practicing aseptic technique, having people come in makeup free or really washing their face off with an alcohol wipe, having them wash their face with soap and a washcloth in the bathroom prior to your treatment. all good practices, but alcohol is your number one. The other thing you want to remember is you can put the lidocaine on. Lidocaine works very quickly. I know the penetration instructions say to let it sit for 15 minutes. I find before I even start talking to them, I ask them what area of the face they're interested in, and I start numbing it. And while we're talking, 15 minutes goes by very quickly. And then all of a sudden, they're numb in the area that you'd want to do. But I've done Botox on myself a million times. It takes 2 minutes to start working. So just slap it on there, but you have to take it off. Gauze and then alcohol wipe. So 1 ml. Obviously, this is a 1 ml syringe. You're going to fill it. We have 18 gauge needles at the med spa. You can also use a 27. They're everywhere. 30s get a little dicey as far as water bubbles, so I don't tend to use 30s, but the 27s we have everywhere because they're stocked in every filler. There's 2 needles. You're supposed to switch halfway through, but there's product loss with it, so a lot of times I won't switch, or I'll use one of my other needles that I want to use. So a 27 works just as well as an 18. So if you can't find the 18, do the 27. In this syringe, there is 1 ml. So in theory, right, you're going to fill it up to 1 ml. I go a little bit beyond the 1 ml. So like 0.02 to 0.03 more to allow for drippage. So obviously we're going to inject 1 ml in here, not point. We're going to inject, we're going to drop 1 ml in here, and then in our neurotoxin bottle, let's pretend this is a neurotoxin bottle, whatever kind, Xeomin, Botox, Dysport, pop the top off, wipe it with an alcohol wipe, stick it in, and let it inject into the bottle, and then swirl. Don't up and down, don't shake it, just swirl it. And then you'll use the bottle top. There's tools to get the metal piece off. You can also use the scissors. The reason we do that is because although this is not FDA approved as a multi-use bottle, and I'm pretending this is now my neurotoxin, my Botox, Xeomin, or Dysport, again, we're always doing 1 ml. Although it's not FDA approved as such, conventionally people are using it off-label as a multi-use bottle. So if the Board of Pharmacy ever walks in the door, hand them the policy book and say, defer to Emily. Here's Emily's cell phone number if I'm ever not there, because that's really what happened a couple years ago when they walked in and there was litigation against them for being so aggressive, and there's a lot of legislation going on regarding all of that. So I don't know when they're going to restart inspections, but officially it's 1 bottle per patient, and it's FDA approved for up to 64 units per patient. So you can show them the fridge, you can show them our stock, but don't answer any questions. Hand them the policy book, say we go by the policies. In the policy, it will say 1 patient per bottle. Anyway, now that you have 1 ml in here, we have 100 units. So I pull up what I need. The reason I pop the top, although it's not aseptic, is because there's only 1 ml in here, right? So any drippage is going to be 2, 3, 4 units. So I want to minimize my dripping, which is why we use the tiny needles. So these needles, these insulin needles, these U100 insulin needles come in a 1 ml, so 100 units. And actually this is for insulin. However, because it's 100 here, that means 100 units of Botox, or 100 units of Dysport, or 100 units of Xeomin, because each line accounts for 1 unit. So this is 100 unit needle. This is a 30 gauge, I believe, 1 ml. So these you can use, it just hurts more. So a lot of people don't tend to use these because they're 30 gauge. I don't mind them. The other thing is these lines are a little bit smaller. So as you're getting used to Botox, you might want to hold off on these, let's say 100 units. We also carry them in the 50 units. So it goes up to 50. So again, same thing. If you want to inject 10 units, you go to the 10. If you want to inject 20 units, you go to the 20. I recommend using 1 syringe per area, because as you begin and as you start, you're going to get messed up. So let's say they're doing 40 units, they're doing 10 per crow's and 20 in their glabella. I would do a 10 unit syringe, a 10 unit syringe, and a 20, because if you put all, let's say you use your 50 unit syringe and you put all 50 in here, and you start on this side and then you're going on this side, and then all of a sudden you look and you're like, okay, I should have used 20 units and you only have 5 left or something. That happens all the time. So the less chance you have of blowing all of your units on one side, instead of like accidentally 3 units here, you know what I mean? 3 units here, or I have an extra 5 units over here, and but I still have enough to spread it over here, so it's not going to look crazy. You're going to be your best bet. So really, as you get better, the less syringes you can use, the better. Obviously, these cost money. But when you're starting, I would do 1 syringe per area. So for example, if I was doing the glabella in the forehead, I would do 2 syringes, 1 here, 1 here. I would do a separate syringe for a lip flip. You know what I mean? So anyway, this is a 50. Again, same thing. It's a 30 gauge, usually, so it's going to hurt more. So I do recommend, especially as you're first starting, to use a 30 unit. And I might have stolen a lot of the biggers. People don't have to use them, but here's a 0.3. So that's a 30 unit. So this holds 0.3 mLs. It goes up to 30 units. This is great for, I'll do 1 for 10 unit for crows. I want to do 10 units on the other side. So there's my other one. And I'm going to do 20 units in the glabella. So here's my third one, and then let's say I'm going to do 10 units in the forehead. I'm going to grab my 4th, right? So now I have 4 syringes for the face. They're all laying out on my chucks or my Mayo stand. Some people take a piece of paper and they'll lay them out and label it and say forehead, and they'll put this right by the forehead label. They'll lay it out and put this by the, left crow, right crow, whatever. Whatever you need to do to keep yourself organized is fine. But that's how you dilute them. Let me know if you have questions.